video to prep for the Appendicular Skeleton lab. So again, I'm using APR. I've already accessed the module and I'm looking at the skeletal system, and I'm using the dissection tool, as you can see right here. Just as a review, we looked at the axial skeleton last week, and that was going to consist of your skull, the vertebral column, the thoracic cage. This week, in looking at the appendicular skeleton, we see that it's going to be comprised of the appendages primarily. In addition to that, it's going to be comprised by what are called girdles. There's a pectoral girdle that's going to attach the upper limbs to the axial skeleton, and a pelvic girdle, which attaches the lower limbs to the axial skeleton. We'll begin with those girdles, starting with the pectoral girdle itself. And this pectoral girdle is going to be formed of two bones. It's going to be formed by the scapula here, and then also by the clavicle. We'll start looking here at the clavicle to begin with. This is the view we want to take a look at. Keep in mind that with every bone that has a duplicate, you must be able to distinguish right from left. And you must include that in the name of the bone whenever you're identifying it, either on a lab quiz or on the practical exam. So here's the trick to the clavicle. You want to see first off that there's two ends. There's a flat sternal end and a rounded acromial end, named for which directions they're going to attach. The sternal end, of course, attaching to the sternum and being more medial. You also want to be able to designate superior from inferior. Now, the superior surface here of the clavicle, just to make sure you're oriented, you're looking at it from the top. This acromial end is going to attach to the more lateral side of the shoulder right over here. If I give you another view right here of the clavicle, we're going to scroll up to where it says lateral. This would be the acromial region. This is the sternal region. So you're looking at the top of this, nice and smooth all the way around. The region of the conoid tubercle, which you can see highlighted right here, is going to be inferior and posterior on the body of the clavicle. So when you find that nice rough spot right there, you know that's the inferior view of the clavicle. And basing from there, you can actually determine right from left pretty easily. So, of course, this acromial region is going to be named for where it attaches to the scapula. So that's the next place we're going to take a look at, is the scapula itself. We'll come right up here and click on where it says scapula. We'll eliminate those muscle attachments, and here you get the best views of the scapula. We're going to look at the right scapula here in these images, and this corresponds most closely here to this view of the scapula. On the list of structures for the scapula, I think the best place to start is going to be to start with what's called the spine. Now, just like I've taught in most of my classes, you can think of spines on people as spines on dinosaurs. They tend to face dorsal or posterior on the back, and this one is the same. So this is the spine of the scapula, and it gives rise to a projection called the acromion, for which the acromial region of the clavicle was going to be named. Once you've found that spine, you know you're looking at the posterior region, and you can start from there to begin to name medial versus lateral. So looking here, again, you're looking at the posterior view where you see more projections. That's going to be the most lateral part here of the scapula itself. Those are going to form essentially what's called the glenoid cavity, where the humerus, or the upper arm, is going to articulate with the pectoral girdle. It's made up primarily here of attachments that run from the acromion to what's called the coracoid process, which is a smaller projection on the anterior side here. So of course, going back to the spine of the scapula, you'll find that being such a prominent marking, many of the other regions of the scapula are going to be named for it. So for example, you're going to have the, let's see if we can find it, the supraspinous fossa, meaning above the spine, and then the infraspinous fossa, meaning below the spine. So those are dead giveaways. You also then can dictate the medial border of the scapula facing towards the vertebral column, the lateral border of the scapula, and then of course the superior border. Now each of these borders is flat, but they meet at what are known as angles, and so you're going to have different angles here. The inferior angle you can see right there, and then of course the superior angle you can see right up there. So that's the scapula. So again, the clavicle and the scapula make up the pectoral girdle, the first part of the appendicular skeleton. Let's use this then to go ahead and move to the bones of the upper arm. We're going to scroll down this list, and we're going to move to the forearm, let's see, forearm and hand. This is the view we're going to start with here. We'll look at the anterior view. So the humerus right here is going to articulate with the radius and the ulna. So we're going to start by examining the humerus itself, right there. We're going to go to other views and zoom out just a little bit so that you can see where it articulates, or just where it looks on its own. So there's your humerus. Okay. So looking at this particular view, you can see both views of what would be the right humerus. So we'll go ahead and eliminate the green color. The most recognizable features of the humerus would be the head of the humerus, which is a nice smooth spot. That's where it's going to form a joint with that glenoid cavity of the scapula. So very smooth for the motion that the humerus is going to go through. You're also going to see two rough spots. One that's a little lateral to the outside called the greater tubercle, and one that you can see on the anterior side but not the posterior that's called the lesser tubercle. And of course, there's a groove right between the two of them that is named the intertubercular sulcus. So that little indentation between the tubercles, that's where it's going to get its name. Running down the shaft of the humerus, you're going to see a few things. You'll see little holes that are called nutrient foramina. This is where blood vessels will innervate the bone, and they're pretty varied in where they can be located. You'll also see a rough spot along this more lateral side of the humerus. It's going to be called the deltoid tuberosity. This is where the deltoid muscle is going to attach to the humerus itself. The most complicated part of the humerus is what's going to be most distal. So a few things to look for. On the posterior side, you're going to see a very, very deep groove. It'll be a singular groove, and that's called the olecranon fossa. The anterior view has two shallow grooves. The one that's going to be most medial is called the coronoid fossa, and the one that is more lateral is called the radial fossa. Now, these are going to line up with the bones that the humerus will articulate with in the forearm. So the coronoid fossa and the structure below it called the trochlea will actually line up with the ulna. So let me show you a view of this. You can see right here would be the ulna articulating right there with the trochlea and the coronoid fossa. And then over here, the radial fossa, and then that more distal capitulum right below it. These are going to line up with the radius. So when you think of the elbow joint, you're actually thinking of the articulations that take place right here in this region. So that's going to be the majority of what you see on the anterior side. You can also see highlighted over here, there it is, what's called the medial epicondyle of the humerus. You can see this in the posterior view as well. And then on the opposite side, what's called the lateral epicondyle. You can see that from both sides. This olecranon fossa over here we mentioned was a singular groove. That olecranon fossa is also going to allow for attachment with the ulna. So let's go ahead and take a look at the ulna then, since we're mentioning it in several places. We're going to scroll back up here to where it says humerus and switch that to the forearm and the hand, anterior view, and we're going to highlight in there the ulna. So the ulna itself is kind of an interesting little bone. It actually looks a little bit like an ice cream scoop because it's got a really nice little groove that fits right there into the olecranon fossa and around the trochlea of the ulna. Of the humerus. So here's what that little ulna would look like. There's your ice cream scoop at the very top. So this is the view we're going to stick with. It does a nice job of showing you how the ulna and the radius are going to fit together. These are both a part of the right arm, so these are going to be distal to the humerus itself. So one thing that you'll note is that the head of a bone in the limbs tends to be more proximal, but it's different here with the ulna. The styloid process, this little projection right here, actually comes off of what is called the head of the ulna. So the ulna is a little bit inverted compared to other bones. Moving up here to the more proximal region, you can see what's called the olecranon, that large projection. This is what the olecranon fossa is going to be named for in the humerus. So you can actually see this posterior view. That groove would be the olecranon fossa of the humerus, and this would be the olecranon itself actually articulating into that groove of the humerus. That's what they're named for. This smooth surface of the ice cream scoop right there at the very inside is called the trochlear notch. Runs right along the trochlea of the humerus, and then it gives rise right here to what's called the coronoid process. So that coronoid fossa right there on the anterior surface of the humerus itself. Again, other views, you can see how that lines up right there, the trochlea and then that coronoid fossa of the humerus. When we move over here to the radius itself, the head of the radius is nice and round. I often say that the circle on the head of the radius, you would be able to find the radius of that circle. So that's sometimes a good way to remember how to identify the radius when compared to the ulna itself. The neck of the radius, very similar to the neck of the humerus. And then, of course, here you'll find what's called the styloid process of the radius. Very similar to the styloid process of the ulna. Keep in mind, these are going to help form articulations with the carpals of the wrist. However, the styloid process of the ulna will be medial, close to the pinky, and the styloid process of the radius is going to be lateral, closer to the thumb. We'll move then to the view that you would see of the wrist. So the wrist and the hand right here. We'll begin with both anterior and posterior views of these. So of course, when we begin to look right here at the views first off of the carpal bones, you find that there's a long list of names. These can be pretty confusing, so we're going to examine them both with the anterior and the posterior view, and feel free to ask your TAs for the mnemonic they use to remember the order of each of these. If it's inappropriate, just remind yourselves that I did not approve of it. Of course, I would never use something like that. So to begin with, you start to name them based on whether the row of these carpals is going to be proximal or whether it's going to be distal. And then you also start naming each one of these beginning with the thumb. That's the best way that most of these mnemonics are going to start to look. So starting with the carpal itself, the first one that you see here is going to be called the scaphoid, followed by the lunate, and then what's called the triquetrum, also called the triquetral bone. And coming off it is a little rock-like bone called the pisiform. So 1, 2, 3, 4 make up the most proximal row. And then you come back over here to this side, starting with your trapezium, that then running more medial once again to the trapezoid, and then the capitate right there, and the hennate. Make sure you can identify those articulated. We will not set out individual carpals on the table for you to identify. The carpals then are going to articulate here with the bones that would form the palm of the hand. And these are going to be referred to as metacarpals. And you need to make sure you identify them based on which digit they are a part of. Metacarpal 1, for example, aligns with digit 1, which is the thumb. And then metacarpal 5 over here lines up with digit 5, which would be the pinky. So metacarpal 1, 2, 3, 4, and 5. Make sure you do indicate whether they are part of the right or the left hand. When you move beyond the metacarpals, you see the phalanges and their features. And so, of course, you'll note here, highlighting them in green, that you can actually see that there are 3 phalanges on digits 2 through 5, but only 2 phalanges here on the thumb, also called the pollex. The individual or the singular term for phalanges is phalanx, ending in an X, and you can see that over here. So when we highlight what's called the proximal phalanx for each digit, you see that this is going to be the one that makes contact and articulates with the metacarpals. Naming these bones would sound as such. This is the proximal phalanx of digit 1, or you could just say proximal phalanx 1. You look at the middle phalanx and you'll see that these middle phalanges only exist in digits 2 through 5, while the distal phalanges will exist in all of the digits. That's going to be the very end of our discussion on the upper limbs of the appendicular skeleton. So tune in to the second video to see our discussion of the lower limbs.